Having UC is a lifelong condition, so it's important to schedule regular visits with your medical team.
Hi, how are you? I'm Laurie. I'm one of the nurses.
Hi, Laurie. Nice to meet you.
Miranda? Hi.
Hi.
How are you? How are you? I'm just going to meet with you and find out how things are going. What other things do you do at school besides your regular academics and that kind of thing? What sort of extracurriculars do you do?
Inside school, I'm with the Drama Guild, and I'm going to look at tennis for the spring. Outside of school, I have my violin, and I have a music band together.
Wow, so it sounds like you're really busy.
Yeah.
Are you keeping up with everything? How's your energy?
My energy's pretty high. It was slow in the beginning, but it's really pumping up now.
We emphasize this is a chronic disease. You will need to be seen by physicians for the rest of your life. You likely will need to take medication for the rest of your life.
This every morning too.
But with seeing their clinicians regularly and being aware of their symptoms, and when their symptoms are flaring, they can lead a full and active life just as they had always hoped.
Laurie was very helpful because we knew that there was a specific regimen and things that we needed to do and things that Miranda needed to take care of, a schedule and a pattern that we needed to go through. And she laid that out very clearly for us.
What medicines are you taking right now?
Right now, I'm on
Prednisone.
Okay. How much?
40 milligrams.
Okay. When we're talking about whether kids are taking their medications or not, or complying with the medical treatment plan, my first step is to be non-judgmental. I don't want them to feel like it's not okay to admit to me that maybe they miss their medicines a couple times a week, or they're not taking them at all. And then once they are able to admit that, then we can talk about strategies. We know that it's hard to take medicines every day, and then work with the child and family to help make that happen as much as possible. Are you taking any vitamins at all?
I'm taking a bit.
And how about any supplements, herbal preparations, anything like that?
She's had some for a while.
As clinicians, it's really important for us to know what alternative therapies children are taking, so that we know that the other medicines we're prescribing, that there's no interaction, and that in fact that it's a safe thing for them to be taking. Let me ask you again more specifically about how you're feeling. So are you having any abdominal pain or cramps?
Very little, if any.
How about more signs of your colitis? How many bowel movements are you having a day?
About 1, maybe 2.
Great, great. Any blood, mucus?
No.
And they're regularly formed, they're not diarrhea at this point?
They're somewhere in between.
Okay, so
most of the time. Yeah.
Okay. And you're not having to get up in the middle of the night to use the bathroom?
No.
Good, perfect. You know, flu shots are really important to get yearly. There's certain vaccines that are live viruses that we wouldn't recommend that you get, so check with us first. The other thing, obviously, you're on all the immune suppressive drugs, so we want to be a little more careful for you. If you get fever or other symptoms, you know, go to the pediatrician sooner rather than later. Any dietary restrictions, or are you pretty much eating whatever you want to eat at this point?
They told me that I could pretty much eat whatever I wanted, just stay clear of skins and nuts during or soon after a flare-up.
A flare of the disease is usually the same symptoms that you had when you were first diagnosed. And if you're feeling tired, if you've got abdominal cramps, if you're not sure whether or not you're having a flare or not, it's best to check with your doctor. If they're worried also, then you might have to come in, get examined, and maybe get some blood tests to help the physician sort out whether it's a flare or something else.
Have you had a bone scan, a DEXA scan yet at all?
I don't think so.
Okay. That's something that with a lot of kids who have inflammatory bowel disease, we're starting to try to screen their bone density, at least as a baseline, to make sure that you don't have either what we call osteopenia or osteoporosis. You see those commercials on TV. Right. And also we recommend yearly eye exams for kids with colitis, just because sometimes the prednisone can affect your vision, as well as you can get inflammation in your eye related to the colitis as well. Do you have any questions about that? The bulk of care of these children really is done outside the hospital. They're going to be outpatients primarily, and what that means is that they're responsible at home for monitoring their symptoms, taking their medications. So they may call in with a cluster of symptoms that they're concerned about, and then they may speak to a nurse. Someone like me will sort of review what's going on and then decide, was a medication change warranted? Is it more serious that we would need to bring you into the hospital and that kind of thing? I just want you to know that I'm available if you have questions. Just please call, because we don't want you to ever feel alone.